My great-great-grandfather started the company back in 1885.
Andrew CRETORS is the president of CRETORS and Company in suburban Wooddale. The company's claim to fame is inventing the popcorn machine you see in movie theaters. It also makes other snack food machines.
Nacho chip warmers, nacho cheese dispensers, cotton candy machines, snow cone machines, all that kind of fun food type equipment.
The company employs more than 100 people, which means it must comply with a new rule under the Affordable Care Act. Beginning this year, small businesses with 50 or more workers must provide health care insurance for employees. Even before the new law, the snack machine company did offer health insurance.
So Marvin's been with us for more than 20 years. How many years, Marvin?
31 and some change.
31.
I'll be 32 this year.
There you go. And when those requirements came out, we met those requirements without a problem. So I wasn't concerned.
And while CRETORS says he supports the basic concept of the Affordable Care Act, he says his company's premiums for health insurance have shot up as much as 25%, and the new requirements have tangled his company in red tape.
At least for us as a company providing insurance, there's a lot more requirements now for documentation and record keeping, and that has greatly increased with Obamacare.
The penalty for not complying can really add up. $2,000 per employee. In a statement, the Illinois Manufacturers Association said the government is imposing harsh penalties that make it more difficult for manufacturers to operate. Illinois has more than 200,000 small businesses. Before the new law, only about a third of them offered health insurance to their employees. The Chicagoland Chamber of Commerce reports that 78% of small business owners had concerns about the rising cost of health care. But more Illinois residents than ever are getting coverage.
I'm Yuri Sardrock.
I'm Chris Stolte.
And I'm Dave Eigenberg. Every day we're faced with unexpected challenges.
And they're not always easy to handle, especially if it's a health issue and you don't have health insurance.
Commercials like this one from Get Covered Illinois are trying to persuade young, healthy people to sign up for health insurance. That lowers the overall cost of health care for everyone. Nearly half of the uninsured are between 18 and 34. Brian Gorman with Get Covered Illinois says they've seen a steady stream of people enrolling as the deadline approaches.
Since 2013, we've seen nearly 1 million people across the state of Illinois have received coverage as a result of the passage of the Affordable Care Act and its implementation here in the state.
One of them is 62-year-old Will Wilson. He was featured on In the Loop more than 2 years ago when the health insurance plan first started. Wilson is HIV positive. The medications that keep him alive cost $3,200 a month. Before the Affordable Care Act, he could not get insurance.
And I never want to go back to what it was like before January 1st, 2014. I am truly, truly grateful for what we have.
The new law has provided other benefits to people such as Dan METIVIER, who builds furniture in the basement of his Humboldt Park home. He says the portability of health insurance under the Affordable Care Act gave him the freedom to start his own business.
Now I have the ability to run my business in the manner I see fit, have the people work for me that I want to have work for me, and to work for the kind of clientele that I want to work for. And I didn't have those opportunities before.
Dan's wife, Rose, says the new health insurance has allowed her to start her own private practice as a therapist. Despite a jump in their premiums from $500 to $650 a month, Rose says it's still worthwhile for them.
I still think that healthcare shouldn't be something that bankrupts you or is something that if you can't afford, then you don't have the ability to pay for something that might be life-saving.
Affordability was one of the biggest selling points of the new law. But Dr. Dan Ivankovich, a Chicago orthopedic surgeon for 20 years, says there are hidden costs in the new insurance plans.
I had to cancel cases where patients are in the holding area and the hospital say, look, you have an $8,000 deductible, we need that check today.
The Affordable Care Act, offering insurance plans for all, was supposed to keep the uninsured from filling up hospital emergency rooms. But a survey by the American College of Emergency Physicians found that ER visits have actually increased in the past 2 years.
There are now too many patients that are in the system. There are not enough primary care providers. There's not enough specialists. And in the end, that's creating wait lists, which equals rationed health care.
Dr. Ivankovich says it now takes longer to get procedures approved and there's more paperwork. He says even his own health insurance has gone up about 30%.
I think the restructuring is definitely needed. I think the way it is currently is probably unsustainable. If premiums continue to go up 30 and 40% a year, that's a doomsday scenario.